Hi, I'm Kavipriya Soma. I'm a GP with special interest in women's health. I have been practicing as a GP obstetrician for the last 13 years in Bentley and Rockingham areas. Today we'll be talking about polycystic ovarian syndrome that's plaguing most of our reproductive age group women. Today we will talk about a very common topic that is plaguing our young women called polycystic ovarian syndrome. I'm sure 90% of young women are plagued by this particular issue. So what is polycystic ovarian syndrome? So polycystic ovarian syndrome it has been around for a long time, but there's been more information that's coming through. Please understand that this is a multifactorial issue. So what that means is it's affected because you're genetically predisposed, so can't do much about that. Secondly, environment. So that's something that you can manage, identify, and correct. And thirdly, it's something called transgenerational. So it's passing from one generation to other. So these are the three important things that contribute to polycystic ovarian syndrome. Traditionally, it has been said that polycystic ovarian syndrome only occurs in obese women, or obese women were mostly diagnosed with it. Yes, there is definitely a correlation between weight and PCOS, but in also saying that there is a category of women who physically appear normal but can also struggle with PCOS. Now, generally the PCOS come to light when a couple are planning for pregnancy, because that's when they pay more attention to the woman's cycles or go looking for a cause in terms of why there is delay in conception. So the three most important diagnostic criteria that we use to diagnose somebody with polycystic ovarian syndrome is there are physical characteristics that can be abnormal, like abnormal hair growth, or of course in areas that shouldn't be present. Important thing I'd like to highlight about women who are struggling with polycystic ovarian syndrome is, yes, they struggle with the irregular menstrual cycles or reproductive issues, but please bear in mind there is a huge psychological component that women struggle as well when they have polycystic ovarian syndrome. And there is a huge lack of focus as health professionals that we fail to address this as well. So I think it's really important that we show more empathy towards that component, making them understand it's just not them or their behavior. It is actually a genetic component that is affecting their ability to progress with the management of their PCOS symptoms. So, in saying that, exercise forms a very important component of the management of PCOS. I know many people, when they come to see me, they say, oh, I've been doing this, I've been doing that, I've been exercising, nothing is happening. Trust me, you may not see any changes for a while, but bearing in mind there's already changes happening within you when you start exercising. Focusing on weight should be one of the last things, but rather focus on the internal environment change that would truly help you overcome this particular issue in this reproductive career. Because PCOS is not just an issue in the reproductive age group, it has its own long-term consequences of diabetes and other metabolic syndromes as well. Now, the second important thing apart from the exercise is nutrition. So nutrition plays a huge role as well in general health, as well as in women who have issues with PCOS. So it's important. It's going to be difficult for me to tailor-make dietary recommendations for you, but what I would generally recommend is increasing your vegetable fruit intake, sticking to whole grain foods. Probably go back and see what your grandparents ate, and that's probably the diet that you should follow. Not to the true sense, but at least to some extent, because that's what we were what was suitable for our own bodies. So honestly, go back and have a chat and look for your ancestors and what they did. That might give you more answers than you ever thought of. So nutrition and exercise form a core part of management. This is, like I said, it's not tailor-made, but it is something that you should go and do your own research and do it. But please follow those two things for your own betterment, not only for now, for long term as well. I just want to add the information regarding the pathophysiology of polycystic ovarian syndrome as well. Let me just get the model. So that's the ovary. Now, nature has designed women in such a way that 1 or 2 follicles are recruited in every cycle, and the body prepares for pregnancy. Now, if there is no pregnancy, then the woman ends up having a period. Now, in a situation where a woman has polycystic ovarian syndrome, the recruitment process is appropriate. Unfortunately, the covering, so the ovarian covering, or it gets really thick, so the ovulation, wherein the egg has to penetrate the covering and come out so it can be picked up by the tube, does not happen. So the egg gives up and it stays within the ovary. So that's why the name polycystic ovaries was given. So the ultimate goal is with diet and nutrition and exercise is to thin the covering of the ovaries so that spontaneous ovulation can happen by itself. So when you visit the doctor, I think one of the most important things they will do is your height, weight. They will also organize for some blood test, checking on your FSH, LH levels. They will also be looking at your general health as well. Apart from that, an ultrasound needs to be organized in a good quality center which can give us the evidence of polycystic ovaries. Please bear in mind, not all polycystic ovaries lead to the syndrome. The appearance and syndromes are 2 different aspects, so please don't get confused about that. And of course, the most important, clinical examination. So these are the most important things that the doctor will do for you before they arrive at a diagnosis of polycystic ovarian syndrome. But as I always say, you don't need a diagnosis to eat healthy and exercise. If you'd like to know more about the condition or have any further questions, you're more than welcome to have a look at our website, athenawomensclinic.com.au, and book through our website. Thank you.